All right, so this is chapter 11, recording number 2. We're talking about different types of medications as far as forms. So the next one we'll talk about is gels. These are semi-liquid. These either can be administered within capsules or in plastic tubes. The consistency is really similar to that of paste or of creams, but they're transparent in nature. So an example would be oral glucose for a patient who has diabetes. You see the tablets up in the bottle, but in that little tube in front, that's actually just liquid glucose that you can put in their mouth and they can eat it in order to raise blood sugar. Gases for inhalation. These are neither solid nor liquid. Typically are going to be delivered through either a non-rebreather mask or a nasal cannula. The most commonly used gas in EMS is oxygen. So we don't really think about it, but oxygen is a medication. So keep that in mind when you're giving that to a patient. It can cause changes within their body. However, most of the gaseous medications are going to be used in operating rooms or at the dentist's office. So laughing gas is a form of medication that you breathe in. You should only administer medications under the authorization of either online or offline medical control. So either talking to a doctor or having a standing order for you to be able to give that. You need to follow the 6 rights when you give medication. So you need to make sure that you have the right patient. Typically in the field, we're only going to have 1, maybe 2 patients overall that are going to need medications at the BLS level. Once we get up into advanced life support, we might have several patients that require medication just because they can administer more medications in the ALS setting. But BLS, typically you're not going to have a huge group of people that are going to require medication. The right medication, so make sure that you have the correct medication. Make sure you verify the prescription, the right dose, verify the form that the medication is in and the dose of it so that you give it the right route, making sure that you put it into the body the correct way. The right time, you want to check the expiration date of the medication, make sure it's not expired, and check the condition of the medication, make sure that it's still well sealed. If it's a liquid, that it's clear, doesn't have any sediment floating around in it. And then right documentation, make sure that you thoroughly document your actions when you're administering to a patient, and then thoroughly document how they respond. When we have a medication error, it almost always results from failure to follow the 6 rights. So following that may help you actually treat your patients better. Medication administration. So your unit typically is going to carry oxygen, oral glucose. You may or may not have activated charcoal, aspirin, and epi. You typically can give these medications only according to standard protocols or under a direct order by a physician. The state and local protocols continue to increase to give EMTs more availability to medication, but that doesn't necessarily mean that your individual service will allow you to give medication. So make sure that you know what your protocols are so you don't get yourself in trouble. So many departments have pretty strict guidelines on what an EMT is allowed to administer for medication and when they're allowed to. So peer assisted, this is where you administer the medication to either yourself or your partner. So if you were exposed to a toxic agent, for example, and you need to administer the antidote, typically these are going to be auto injectors, and you're going to administer it to yourself or to your partner. Patient-assisted administration, this is you actually helping the patient take his or her own medication. So it's prescribed to them. but they need a little bit of help. Some examples would be nitroglycerin that is prescribed to them, not the stuff we bring with us, EpiPen auto-injectors, and metered dose inhalers for lung conditions. The final is EMT administered medication. This is where we give medication that we've brought with us to the patient. It may be that they're altered or they can't understand that they need the medication, and so we're going to go ahead and provide it to them. So oxygen, oral glucose, activated charcoal, nitroglycerin, or aspirin. The medication itself doesn't necessarily determine if you'll be assisting with its administration or actually just administering the drug. It's your protocols that are going to determine that. So make sure you know what the rules are governing that. Oral medications, the state, the Department of and the medical director will define which medications are carried by your ambulance. There is a print, it's the 2009 National EMS Education Standards, that recognize that some regions of the U.S. may need their EMTs involved in the administration of additional medications. These are those aside from oxygen, oral glucose, activated charcoal, aspirin, and epinephrine. Examples would be acetaminophen, also known as Tylenol, ibuprofen, also known as Aleve, and then diphenhydramine, also known as Benadryl. Overall, though, we do have some oral medications, considerations for wanting to give oral medications. It's ease of access. You just have to have the patient take it. Typically, they're going to be a lot more comfortable with taking an oral medication rather than having an injected medication. The disadvantages, the digestive tract can easily be affected by food, stress, or illness, and it also depends on the speed at which food is moving through the digestive tract. So your absorption can be severely affected. In order to give an oral medication, you're going to take standard precautions, so typically putting on some gloves, confirm that the medication is not expired, obtain medical direction if you need to per your local protocol, confirm that the patient has a patent airway and is able to swallow, and then instruct the patient to either swallow or chew the medication depending on how it should be administered, and then monitor their condition, document that you gave it, the time that you gave it, and what any responses were by the patient. Activated charcoal can be one of those oral medications that we give. Many poisonings involve overdoses taken by the mouth, so people take in pills. Activated charcoal reduces the amount of medication that's actually absorbed by the body because it surrounds whatever foreign substance or toxin that they've ingested, and it binds it all together and then creates a covering over top of it so that it can't actually get into the body. Activated charcoal is typically ground into a very fine powder so that it has a greater surface area for actually binding to the toxin itself. If you do have these or have activated charcoal on your service, you typically are going to have a suspension of activated charcoal that you have to mix with water. You can see the pill form of it on your screen here. I have never given activated charcoal in pill form. It's always been in a liquid. But activated charcoal is frequently suspended with sorbitol. That's a sugar, and it has more of a laxative effect that causes the medication that you took that you shouldn't have taken and the charcoal to move pretty quickly through the digestive system to reduce the amount that you actually absorb. You want to administer by mouth, and typically they're not going to want to drink it readily. It looks nasty. It tastes nasty. For a while there, they were trying to come up with like a strawberry flavored, but it still is just as nasty as the black stuff. Typically, if you put it in a covered container and just give them a straw where they can't see it, they do a little bit better with it, but they need to drink it as quickly as possible. Keep in mind that it does stain. It is black and it's thick. So try and protect your clothing and the patient's clothing. There are some instances where we would not give activated charcoal. So if they have an altered level of consciousness, we certainly don't want to give this to them because it increases their risk of aspiration or breathing it into their lungs. Or if they've ingested an acid, an alkali, or a petroleum product. Oral glucose is another oral medication that we give pretty much on a regular. Glucose is sugar that the cells use for energy, and it's necessary for especially brain cells to survive. Your brain, as far as food, only uses oxygen and glucose. It doesn't use anything else. So if a patient has hypoglycemia or a blood glucose that's lower than normal, then we're going to give them oral glucose. This can be caused by not eating or taking too much insulin. You're going to give it by mouth. EMTs can only give glucose by mouth. So you're going to use the gel that we saw earlier, and you want to spread it on the mucous membranes between the cheek and the gum. This is not going to be as quick as injections, which can be given by ALS providers in the hospital, but it works. You can also use glucose tabs. You could also use regular food that has a lot of sugar in it. So giving them some juice, that will bring them up pretty quickly as well. And they tend to take that because oral glucose is extremely sugary. Like little kids love it, but once you start getting a little bit older, it's just too much sugar. So if you have to, we've got this, but just giving them some sugar containing food works pretty well also. Aspirin is another oral medication that we're going to give. There's a couple of different reasons that we give aspirin. It's an antipyretic, which means it reduces fever. It's an analgesic, meaning that it reduces pain. It's an anti-inflammatory drug, so it reduces inflammation or swelling. It inhibits platelet aggregation. That's just a very fancy way to say that it keeps platelets from clumping together to form a clot. So this is useful during potential heart attacks where you already have a clot and we don't want to make it any bigger. Contraindications when you should not give it. If there's a hypersensitivity to aspirin, also known as an allergy to aspirin, if they have pre-existing liver damage, bleeding disorders, or asthma, because it inhibits platelet aggregation, it can actually cause bleeding. So if they've already got a bleeding disorder, we don't want to make that worse. And it is filtered by the liver and changed into something that the body can actually use. So if your liver's not working, the medication's not going to do what it's supposed to. And we do not give aspirin to children. It can cause a condition known as Ray's syndrome. No, we just don't do it. Okay. And we'll go ahead and stop here and continue on in the next video.